because again, that's something you have to treat within 48 to 72 hours after onset of the lesions, because past then you really don't make a, it's not just like you don't, the benefit from the medication is not that great.
Right. Well, I know I had shingles one time, and it was such a mild case, and I didn't have a clue what it was. And I think I'd had it about a week and a half before I went to the doctor and went, what is this?
Yeah. But the recommendation, if you look at the literature for the antivirals, is, you have to catch it within, I think it's 72 hours, 48 to 72 hours. So past then, the benefit from the medication is really not there. So if you give it to somebody, is it more to, kind of like, maybe, we'll see. They haven't shown any real benefits after that time period.
Well, other than placebo effect.
So. Exactly.
So, well, what else? Is there anything that you wanted to cover that we haven't gotten to this week?
No. I mean, there are many causes of chronic pain. I mean, like, I've had patients that, stay in the ER with migraine headaches. So, requiring pain medication. And that's something that, you just can't imagine. But again, those usually are people that need to be seeing a neurologist and have addressed, if you're going multiple times for things like migraine headaches, then you need to be on something every day to decrease the incidence of headaches.
What causes a migraine?
Well, there's some question about what caused it. It used to be what they said. It was like, they said, do you wonder why you always get a migraine, not when you're stressed, but after you're stressed? And it's almost like there's talked about there being a constriction and then there being dilation of vessels. And that's what caused the pain, not from the actual constriction, but the dilation of vessels. There's still some question about that. So, that's what people have thought about for a long time. But there are many medicines you can use for people with migraines that are, more, if you have more than 4 or 5, if you have a headache every week that puts you down and where you can't work or do your normal activities of daily living, then you probably need to be on something daily.
And now there's also a thing that's not a migraine called a cluster headache.
Cluster headache.
And what's the difference in those?
Well, the only is cluster headache is exactly what it says. It's a headache that lasts for a prolonged period of time. You can go ages without one, and then all of a sudden you have a headache that's there for a period of time. And so that's a difference. That's the reason they call them clusters. Clusters are probably more common in men than women, whereas migraines are probably more common in women than men.
Well, I don't have either one, so that's... I have lots of friends who do, but I don't. So.
And a lot of times, some people, I'll have people and they say, I have migraines. And I'm like, has there ever been a diagnosis? No. And sometimes people have tension headaches. And they'll tell you it goes up the back of their head, and that's everything feels back here. And if those muscles tighten in your neck because they connect to the base of your skull, you can get a lot of pain from that. Usually migraines are one-sided, and they're not both sides. And some people can have sinus headaches, and they'll notice a change, when a change in weather causes them to have headaches. And so there are other causes of headaches other than migraines.
Right. So, but if it's kind of spread evenly across your head, across both spheres of your head, then it's probably not a migraine.
Yeah, usually. I mean, some people have atypical migraines, but usually migraines are one-sided.
Okay.
So. And that's the thing, and the only thing is pain from a migraine should not change with head position changes. Those are, you think, more things like sinus headaches, because you think about go down here and the pain, that the pain gets better or worse, and you're thinking more of a sinus headache.
Yeah.
If you can move and cause the pain to increase, then you think about muscle tension.
Well, those are the two I get all the time. So.
Yeah.
And I can tell you when I get them, which one is which.
And you can, sometimes if people, because of where the muscles are, if you have problems with your neck, sometimes arthritis in your neck can cause you to have headaches.
So anything that causes pain over what time period, we should probably go visit with someone.
If the pain doesn't change and is just constant for a week to 10 days, I would say, without any relief, long-term relief from some over-the-counter medication, I would say so. I mean, of course, acute pain that's severe, you don't want to wait for that. But if you have something, kind of like, well, I don't know, it's a little bit of something, but it's always better to be safe than sorry. And for you to go in as doctor say, oh, that's nothing, that's fine. But, if you have one episode of pain and it never returns, then...
And at what point, when something hurts, do you, A, pick up the phone, call the doctor, make an appointment as soon as possible, or B, get in the car and go to the emergency room?
Well, the thing about, acute pain, things like appendicitis, and stuff like that, pain associated with fever, increasing, loss of appetite, nausea, vomiting. Those are kind of things that go along with pain that make you concerned. And that's the thing about that is, if you have severe chest pain, that's like a red flag. And I mean, if you're not, if you're one of those well-heeled athletes that runs a marathon, then probably your heart's been stressed enough that chest pain is probably not cardiac. But if you're past a certain age and you get severe chest pain, don't just put it off to being indigestion. But
well, and in women too, it's not even just
atypical. Yeah, exactly.
I mean, a lot of women don't have chest pain.
Nope. They may have a little discomfort in their neck and stuff like that, and just not feel right. Just kind of like not feeling off a little bit, just not feeling up to par.
So then how would you find out that, I mean, other than they keel over dead?
Yeah, and the thing is, I think that's the reason a lot of women get missed, because they don't have the typical pains. But if things are spread out, they last a long time, that's when you become concerned. And that's, the thing is, if you feel like you're going to faint with some kind of like ill feeling, that's probably a reason to go and see somebody. But if especially if you have high blood pressure, diabetes, those are things that, again, alert you to the probability of you having a heart attack and being increased risk for that. So that should put an added thing, and so you should be more cognizant of things. If you're somebody who doesn't have any of those risk factors, you go to the doctor, you've had your cholesterol checked, things like that, then, sit a little bit better with you. I mean, if you have, again, things like family genetics, those things also play into it. So you may not have ever had any symptoms, but if your father had a heart attack at 50, then that's, makes you a little bit more aware, like, maybe, I don't know. So
might at least go, get an
go and
EKG run or something.
Have somebody reassure you. That's the thing, I think,
yeah,
is to be reassured sometimes. And that's all people want sometimes, just like,
yeah. And that's with a lot of things.
Yeah. But like I said, if you have acute pain that's severe with fever, nausea, vomiting, to me, that's something that you need to go and see, because sometimes people will have appendicitis, and what they'll do is they'll have acutely those symptoms, and then what they'll do is they'll have an abscess that walls off, and so the symptoms decrease. So that's, acute pain is totally different from chronic pain. Chronic pain is usually most people consider chronic pain to be after 6 months or so. Certain things may be sooner, but 6 months, if you've had pain that hasn't been able to be relieved by anything, then it becomes chronic pain, unless you have a source that hasn't been treated. So that's the thing.
Okay. Well, let's open it up for. Send us an email, give me a call, give Dr. Jackson a call, whatever you'd like us to be discussing next month. Let's see, what date will you be here next month?
I don't know what day of the week it is.
Let's see, what are we in? We're in June.
We're in June,
so you will be here July 1st.
Okay. 1st is on a Wednesday.
That's it.
Okay.
So July 1st, Dr. Jackson will be back with us. So if you've got something you would like her to discuss, send me an email at alexad@kwrdonline.com. You can give us a call here at the radio station, and we'll make a note and pass it on to the good doctor, and we'll know ahead of time what we're going to talk about.
Sounds good.
So thank you again for being here every month. We appreciate it.
I enjoy it.
We're getting good at this. We're taking longer and longer. That's the great thing about being in the afternoon. Now we can take longer if we want to.
Okay, good.
And we want to thank all of you for joining us today, either on the air or online. Don't forget, you can always listen. We stream the show live at kwrdonline.com. And if you missed part of it, you can always go back and pick up the archived shows on our website. And you can watch last month's show with Dr. Jackson, and I think we have the month before that on here too. So go back and catch up on anything that you might have missed. So I'm Alexa Duke. Thank you for joining in, and be back here tomorrow at 4 o'clock for more of the Talk of East Texas Roadshow.